organizational communication in the healthcare context, specifically in the hospital setting. So this might be a bit basic for some of the great scholars in the room, but I thought to contextualize what I'm going to be speaking about, we should look at the basic levels of communication. And as Paul actually just talked about, and I didn't prepare this having looked at the agenda, but pharma advertising is one example of mediated and mass communication in the healthcare context. You also have things like interpersonal communication, which is between two people. Specifically in the healthcare context, what's most often studied is that relationship between patients and providers. And all of these are affected by technology and culture. What I'm particularly interested in is organizational communication. And what I tend to look at is, in a hospital specifically, how do messages get transferred from the top, from the CEO, all the way down to the bottom, from the bottom up, and everything in between. And I think it's extremely important in our current healthcare environment, and I think that I'll be able to prove that with some examples and a case study. Also, one reason that I'm interested in this field is there seems to be sort of a lack of research in this area. There's a lot on organizational communication in other settings, more corporate settings, and then health communication tends to focus on interpersonal communication, mediated mass communication. I think that after this year, you're going to see a significant increase in public communication since the Obama administration has done some very interesting things that I think a lot of communication professionals want to take a look at. And also small team and group communication. I found a lot of research about how nursing units communicate and how they communicate with other departments at the hospital. But there's very little research on how the entire organization has this sort of communication across all the departments, and up and down communication between administrators, physicians, mid-level managers, and line-level employees. So another reason I think this topic is important is because of the current healthcare environment that we're in. This is data that I found from the American College of Healthcare Executives. And what they do is survey CEOs of hospitals to find out what are the most pressing issues that your hospital faces. Unfortunately, this is the most credible data that I can come up with, but as you can imagine, a CEO's concerns are going to be significantly different than a physician's concerns, and also a lower level employee's concerns in the organization. But it's what I have to work with. So I thought that if you go through this list, I'm not going to go through all of it, but the top three are very environmental. I think even though hospitals can affect change on their financial health, it's always going to be the number one concern for a CEO. It's just the nature of the organization. It costs a lot of money to treat patients, and patients don't want to pay a lot of money for care, obviously. So I think that's always going to be a very difficult balance that hospitals are going to have to face. As far as health reform and care for the uninsured, I think this survey was conducted in 2009. Obviously that was on everyone's mind. But I really want to focus on what's after that, particularly patient safety and quality. I would argue that pretty much everything on this list can be solved or at least improved using organizational communication. And I'm going to show you an example of that as well. But first, any good communication research study should be driven by theory. And I think the most relevant theory here is one called organizational information theory. And that was proposed by Carl Weick. And basically the theory says, how does an organization make sense of all the information that is transferred internally and from the outside world, particularly in a hospital where you have several different departments that do everything, ranging from administration, accounting, food service, to cardiac surgery. Departments tend to communicate well with each other, but often there is a lack of communication that exists across all the departments in the hospital. And each department has a significant amount of information that they look at. So cardiac surgery might say, how long do patients generally stay in the hospital after they've had their surgery? How long does it take for them to be well enough to go home? Another department might look at how much money it costs per patient. Another department might look at how are our patients being treated? Are they satisfied? Are they safe? Are they healthy when they leave? But that information is never really integrated. And the departments sort of act as silos where, you know, one of the department's quality improvement, let's say, might have really great information about patient safety and satisfaction in the hospital. But that might never get to the Department of Cardiac Surgery. They might be focused on improving results and how long their patients stay in the hospital so that they can get them out and get another patient in. And I think that the challenge here is really being able to share that information, making it relevant for every department, and creating a centralized message. One of the main themes of this theory is centralizing organizational goals. I think that's really the key. So I want to do a quick case study, which I think is extremely relevant. This is from 1996, so it's a little dated, but I think that it's still a model that hospitals today could really benefit from taking a look at. And this is from, it's a Harvard Business Review case that occurred at Duke University Children's Hospital. And the case was actually written by their chief medical officer. So in 1996, the hospital was experiencing an $11 million annual operating loss. That's not good, particularly for a hospital whose goal is to provide excellent care for patients in their community.